Jerry Taylor, the co-chair of the ACHA COVID-19 Task Force and former Associate Dean and Director of the Health Center at Bentley University in Waltham, Mass. Today, we're discussing the ACHA Fall COVID-19 Guidelines. I'm here with Dr. Bev Kloeppel, a member of our COVID-19 Task Force and previous director of the Health Center at the University of New Mexico. She wrote the guidelines on masks. Bev, thanks so much for joining us today. Would you go over a few of the most important pieces from the guidelines?
So,
Bev?
fitted masks, worn properly over the nose and mouth, and fitted well, can help prevent an infected individual from spreading the infection to others, and it also helps an uninfected individual from acquiring a new infection. So masks are an effective tool to help prevent the spread of SARS-CoV-2. The level of protection also depends upon the mask, with a NOSH-approved N95 being the most effective, KN95s next, then surgical mask, and then cloth. So sort of in that order of protection, although you can get additional protection with double masking and some other ways of wearing masks to help, but a well-fitted is important. The mask, when do you wear a mask? Mask recommendations should be guided by the level of community infections and the vulnerability of the individual to severe COVID infection. There's a website on the CDC about community levels where you can put in your zip code and it will report what the community level is. And based on that, that should guide mask wearing principles. High vulnerability individuals or high risk individuals, of course, masks will be recommended sooner rather than later regarding community levels. For institutions of higher education, masks should be made readily available if the local conditions warrant, or if the level is high enough to warrant masking. And health services on campuses should consider universal masking for staff and patients. So masks remain an effective tool. They certainly have been politicized in the past, but hoping to move masks into a practical tool that can help prevent the spread of COVID, protect you and protect others from infections with SARS-CoV-2.
Thanks so much, Bev, for sharing your expertise and this valuable perspective with our audience today. And many thanks to our audience for watching this video. If you haven't accessed the updated ACHA fall guidelines, you can find these resources on the ACHA website. If you have any specific questions, email us at contact@acha.org. And if you'd like to join the discussion on this and other COVID-related issues, go to ACHA Connect. Thanks again for joining us.